Hi there, welcome to Study Race. Today, we are going to study about rheumatoid arthritis that affects people of all age and ethnicities, but some groups are more likely to develop rheumatoid arthritis than others. Rheumatoid arthritis is a chronic autoimmune disorder. In rheumatoid arthritis, the body's immune system mistakenly attacks its own tissues. It causes joints to become painful, swollen, warm, stiff, and deformed. It primarily affects the joints, but can also impact other parts of the body such as the skin, eyes, and lungs. The disease usually occurs between 30 to 50 years of age, mostly affecting women, 2 to 3 times more than men. It can also occur between 7 to 15 years of age. It affects approximately 1% of the population worldwide. There are 3 different types of rheumatoid arthritis, that are seropositive rheumatoid arthritis, seronegative rheumatoid arthritis, and juvenile arthritis. Seropositive rheumatoid arthritis refers to the presence of RF, rheumatic factor, or antibodies in the blood of person diagnosed with rheumatoid arthritis. They have RF and anti-CCP antibodies that can attack the body and inflame the joints. Seropositive rheumatoid arthritis is associated with more joint damage, deformity, rheumatoid nodules, development of vasculitis, lung issues, and extra-articular manifestations. Seronegative rheumatoid arthritis refers to the situation where both antibodies are absent. The diagnosis of seronegative rheumatoid arthritis is based on signs and symptoms of the condition, including morning stiffness, joint stiffness, swelling, pain, and symmetrical involvement of multiple joints. Like seropositive rheumatoid arthritis, systemic symptoms are common, such as fever and fatigue. Juvenile rheumatoid arthritis, also referred to as juvenile idiopathic arthritis (JIA), is a form of rheumatoid arthritis that affects children aged 16 and under. In juvenile rheumatoid arthritis, kids often have growing pains, the pain, stiffness, and swelling. Children with juvenile rheumatoid arthritis may also have fevers, rash, and swollen lymph nodes. If we talk about etiology, the exact etiology of rheumatoid arthritis is not fully understood. It is believed to be a result of a combination of genetic, environmental, and hormonal factors. Certain genes that affect how the immune system works may lead to rheumatoid arthritis. The factors triggering immune system are environmental factors, genetic markers, antigen-dependent activation of T lymphocytes, anticyclic citrullinated proteins, tumor necrosis factor, and other risk factors such as gender, age history, smoking, obesity. If we talk about pathophysiology, the inflammation in rheumatoid arthritis is immune-mediated with evidence of activation of cells of immune system and production of abnormal antibodies. It is not clear whether this is an autoimmune process or is triggered by an external antigen such as virus. It is considered that the IgM type of autoantibodies are in VU, called rheumatoid factor. These autoantibodies form immune complexes within the joint space and responsible for inflammation of synovial cavity. The synovial membrane becomes highly vascularized and hypertrophied, creating a so-called pannus formation. Inflammatory cells involved in rheumatoid arthritis include T cells, B cells, macrophages, and plasma cells, which release cytokines that cause the synovium to release proteolytic enzymes, resulting in the destruction of bone and cartilage. Key cytokines involved in rheumatoid arthritis include TNF-alpha, interleukin-1, interleukin-6, and GM-CSF. The whole process can be described as follows. Please pause the video and look at the procedure. Symptoms of rheumatoid arthritis are very horrible, and may include painful, tender, and swollen joints, temperature may be raised, morning stiffness in joints, fatigue, fever and loss of appetite, weight loss, anorexia, loss of appetite, anemia, splenomegaly. Diagnosis of rheumatoid arthritis can be done through X-ray of the joint, white blood cell count, blood test, for the evaluation of antibody called rheumatoid factor. ESR determination, elevated ESR and WBC count is a positive test. Synovial fluid analysis. Treatment is done through anti-inflammatory drugs that control swelling and inflammation. Corticosteroids that control pain. Chloroquine and hydrochloroquine inactivates the enzymes released by neutrophils and provide relief from inflammation. Anti-rheumatic drugs like gold compound. If the above drugs are incapable of controlling the condition, surgery. At last, thank you.